I have a question for you. Do you have a case fee for your patient's treatment, or do you individualize every procedure and give them a printout? One of the things that I found very useful in our practice is to give patients a case fee at the beginning. And oftentimes the case fee will have everything that they need, but sometimes I have patients maybe want a stage treatment. They said, well, I just want to do initial therapy this year, and maybe I'll do the surgery next year. Let me just do the initial therapy and clean things up, and I'll do maybe one implant, but I'll do the veneers next year. So I'll give them various case fees, but every procedure or series of procedures has a case fee. What I don't do is I don't write oral hygiene instructions, scaling root planing upper right, scaling root planing lower left, etc. Class 2 restoration, veneer, implant, abutment, etc. What I have found is when patients come in with a Dentrix printout or any printout from your computer and they have all the fees, it's very confusing. As a dentist, I look at those 2 or 3 pages and I'm confused as what the dentist wants to have done. So what do? I talk to the patient. We determine what our treatment plan is going to be, and I give them a case fee for the plan. I don't talk about extra fees for, membranes or growth factors or how much gauze is, how much sutures I have. If an implant fails, that's included in my case fee. So everything and all the pros and cons and all of the various complications that may occur in the future are taken care of in that case fee. What we also do is we have the patient pay us 3 weeks before we begin treatment. So we get paid up front. So we become the bank for the patients. You may or may not feel comfortable doing that, but we found that very, very helpful. Because the patient pays us up front, they paid us for, if you're going to buy a car, you pay for the car before you receive it. The same thing here in our practice. They pay for that treatment up front. And they've trusted us because we have a good relationship at that time. And then they come in, they don't have to pay us anymore. So they can come as many times as they want. It could be 40 or 50 visits to get things right. There's no additional fee. We're happy to take care of them, and we give them tremendous value. But they don't think about money ever again. Now, if you're an insurance-based practice, which 90% of you are, you're going to have a fee for every procedure, and you'll put it into the insurance. But doing it as a case fee, you still can put it into the insurance, and you can still break it out that way. We're a fee-for-service practice, but we submit for every patient who has insurance. So we have a fee for all of that, but they get the case fee. And what's nice about that is there's less confusion. There's less ambiguity because the patient knows what the fee is and they know we're going to take good care of them. Now, how do we clarify that with the patient if we don't give the computer printout? Well, every new patient gets a comprehensive letter that's sent by me, and it's in plain English. It'll say the diagnosis and the treatment plans. If they're not sure what they're going to do, they may have 3 or 4 different treatment plans there. And each one will be explained. And then I'll say the case fee for doing this is this. And it's easier. There's nothing more confusing than dealing with insurance companies and all the different perturbations that they have. And so one of the things that removes some of that confusion is to be very clear in your communication with the patient. And the insurance companies are pretty much there to give the patient a little bit of an aid, but as you know, there's no dental insurance. It's just an aid. There's no such thing as insuring someone for their dentistry. They'll get $1,500 or $1,000 or maybe even $2,000 a year, but 50% of the patients don't have insurance at all. So really insurance becomes a blockage. The biggest blockage we have to dental care in our office is when patients say, well, my insurance cover that. And we get rid of that right away. So how do we handle the insurance blockages? I said, well, our fee for this is this, and insurance is not insurance. It's an aid to help you. And we'll get every dollar possible from the insurance company. And I have Karen in my office that does everything. She's just dedicated to do insurance. So I have a fee-for-service practice, but I have a full-time insurance coordinator. And why is she there? Customer service. That's the only reason. And oftentimes when patients are very insurance-driven, they get caught up in that. It becomes our fault if they not get paid. So we want to take that right out. We want to eliminate the insurance as a blockage to care. And because it oftentimes is. And that blockage hurts the patients because they don't get the treatment that they need, and therefore their mouths get worse over a period of time. So my goal in our practice, or our practice team goal, myself, Dr. Ma, Dr. Koo, my entire hygiene team, is to do everything possible to get the patient healthy and disease-free. I don't want to retreat my patients. I want to get my patients in the hygiene room, and I want to get their teeth cleaned every 3 to 6 months, depending upon what they need. And I don't want to treat them again, unless something bad happens. But most of the time when they're in the hygiene room, if they're under good recall, there's no disease. There's no caries. There's no periodontal disease, and periodontal disease is controlled. They get into an accident or something, we'll take care of that, or an old restoration breaks. But most of the time, I don't have to do that. So case fees are very important. They will elevate your practice and get the patients into the hygiene room under recall where they don't have to spend money and money and money over and over again. Because my average patient probably spends $10,000 to $15,000 every 7 to 10 years on a restoration that's going to break down. My goal is to stop that downward spiral of care. So that may or may not be important for you, that may not resonate with you, but one of the things I found very, very helpful was to give the patients a case fee and not to nickel and dime them. I've been in offices where a patient will leave after spending $5,000 for a surgical procedure, and at the front desk they go, oh, by the way, they put in another implant in that area. It's another $2,500. Or by the way, the dentist did a bone graft at that time. So what are you going to, there's a little bit more fee for that. When I give the case fee, if I do 5 implants and I only charge them for 4, there's no additional fee if I think it's necessary at that time. Or if I do a bone graft, it's included. Or here's something that happens. We go ahead to do an implant. The patient pays me for the implants in advance, gave them the case fee, and I go to place the implant, but it spins. The bone is soft. I have to remove the implant. Now I have to do a bone graft. What do I do in that situation? There's no additional fee. They paid me for the implant. And when I redo the implant or I do the implant for the first time in 3, 4, 6, or 8, 9 months, there's no fee at that time. So it's all included and there's no buyer's remorse. So hopefully that was helpful for you. I know I went on a little bit long for that, but I think it's important because I find this so much confusion. I work with many different dental offices and almost nobody gives a case fee. And I think it'll really eliminate a lot of the barriers to treatment. Have a good day, everybody. And remember, be the gift.